So next up, we have Rishi Lamichhane. Rishi is one of our research assistants here at Nourish. Not only that, Rishi is actually our first research assistant at Nourish, and I think our second staff member total, for which I'm so grateful. Rishi came on, right after we founded. I had a summer internship, kind of ad program, and Rishi reached out, was really interested in public health and biostats at the time. And as I shared in my presentation, I said, I only know enough biostats to teach my students. I think you probably know more than me already, which has proved to be true by a long shot. But I think I can mentor you in biostats. We're just so grateful. I'm so grateful to have you, Rishi. We've learned so much. I've learned so much. I think that you are working, so I don't think maybe caught I think you've seen my presentation before, but just the work that you've done and the perspective that you bring, it just really has helped to expand the way that we can communicate qualitative research, which I think is amazing. And I'll give it a little bit of a pause there. I'll just kind of add. So Rishi was recently accepted into Brown University in their Masters of Public Health. He's decided to defer for a year, which selfishly I love, means we get to a little bit more. And I'm leaving out so much. I'll turn the time over to you, and we're just so grateful to have you be here.
Thank you, Dr. Berry, for the introduction. Hi, everybody. My name is Rishi. I am a recent graduate from Springfield College in Springfield, Massachusetts. I did a double major in public health and computer science. And yeah, I'm just working full time for a year. That's why I deferred my admissions at Brown. I'll be joining there like next year, probably around like September. So I'm excited for that. I'll just share my presentation. Can you see it?
Yes.
Okay. So yeah, I am taking a gap year right now. I'm working full time in social work, and my plan for this year is to continuing doing research at Nourish and learn more and publish and do all good things. So today I will be presenting on well, my topic is connecting the dots. You'll know by the end of the presentation why it's called that. And this is since I joined Nourish for last year, around July. I've learned a lot in the process. I've discovered different ways to do qualitative research, like how to do better data visualization, which is something we need at this day and age, and also learn different techniques and different software, different programs to present qualitative data more effectively. So we'll be talking about that. Before diving into what my work majorly, let's talk a little bit about binge eating disorder. So binge eating disorder is basically autonomous eating disorder diagnosis recognized in DSM-5. It's characterized by episodes of eating objectively large amounts of food in discrete period of time. And it's also coupled with the sense of loss of control as well as significant distress after it. And this actually isn't rare. The lifetime prevalence of binge eating disorder is around 20%, meaning 20 out of 100 people have it. And that's a lot of people if you talk about it. So, and it does not exist in isolation. We have found that binge eating disorder exists with depression, anxiety, chronic illnesses such as cardiovascular diseases, obesity, diabetes, and so on. So it's very important to talk about it. Moving forward, we have some stats over here. So why is this work important? Like it is backed up by the evidence and the data. As I mentioned, 1 out of 5 people have binge eating disorder at least once in their lifetime, among which 95% of it goes undetected and untreated, whereas treatment success isn't a lot. It's around 45%. It's less than 45%. And among those treatments, the reoccurrence happens 65% of the time. So we need a lot of work to do there, right? Moving forward, we have who experiences binge eating disorder. So We may see this a lot because this is the most research that's been done. It is not limited to skinny, white, affluent girls. Everybody suffers it, but in fact, the higher prevalence we can see is in BIPOC community, LGBTQ plus communities, and food insecure population. And yeah, there's a lot of stereotypes that it only occurs to skinny white girls, but that's because that is where we have most research. The research is lacking for underrepresented communities or like people of color, LGBTQ plus people. In fact, people who experience food insecurity are face like 2 to 3 times more rates of binge eating disorder, which is very alarming, and more work needs to be done in this area. So that's something Dr. Bray's research focuses on because it's about social justice as well. Moving forward, we have the gaps, of course. So there's research limited to treatment-seeking samples. The sample size is very limited, as well as the sample is very biased. So that's one thing that we see a lot of research gap on. We also see many complexity of environmental factors poorly captured. So we don't see a lot of environmental factors to begin with, but also if they do some research on environmental factors, there's something lacking, like they don't talk about how those factors are interrelated to each other, for instance, or how they can be visualized better so the public can look at the data and understand the data more clearly. And there's no clear way to visualize interrelated themes. So they just put all the themes in a linear sequence, but that is not how it works. Like all the themes are related to other themes and so on. So that is something we found research gaps on. Because the sample size is limited and the population is biased, we do see very low external validity. And then also, like, there's so many systemic and environmental factors that goes missing, or the interrelationship is not captured fully. So that's something we found is lacking in the research area. And moving forward, so talking about the solutions, we need free or low cost solutions. We need virtually accessible or community-based solutions. That's where public health comes in because it talks about community aspect. We need inclusive of marginalized group, both research and interventions, and it has to be free of stigma. It is very stigmatized. While I was making this presentation, I wanted to put some pictures that could be relevant to the issues, but either it was biased or it lacked representation online. So I was like, no, I'll just put like pictures that are relevant, like related, because I didn't find much. So there's a lot of stigma related to it too. Moving forward, we have the work that we did. So our approach was, the application was network mapping, or we called it thematic mapping to qualitative binge eating disorder data. The tools we used were Kumu and Python, and our goal was to visualize environmental factors. We'll get in depth about it. So the study data for the research I did was Bray et al. 2022, which was the primary research done by Dr. Bray. It's on social justice. And then here I have so yeah, it was like a mixed method study conducted by Dr. Bray, and then it involved 14 internationally recognized binge eating disorder experts. It consisted of clinicians, researchers, healthcare administrators, and so on. And they were selected based on funding history, publication, leadership roles, and active practice. And then through semi-structured interview, they identified 12 major themes, and you'll keep hearing me repeat the word themes and sub-themes. So these themes are the themes from the research that was done by Dr. Bray and the team. And these 12 major themes are the environmental factors of binge eating disorder. I don't remember all the themes, so you have idea what I'm talking about. These include invalidation, systemic oppression, marginalization, economic insecurity, stigma, trauma, food and nutrition insecurity, interpersonal factors, social media, predatory food industry practices, and research or clinical gaps. So these were the 12 major themes that was found by Dr. Bray during the mixed method study. As I mentioned, moving forward, we're a mapping protocol. So this is where our work comes into existence. So we use two softwares. One was Kumu and the other one was Python. So Kumu, if we talk about Kumu, it was very user-friendly, interactive, accessible to non-technical users, or very limited coding, while Python was a little more advanced customization. We had different packages that we could use for better, like for different variety of visualization, and it did require coding expertise. As a student of computer science myself, it was still very difficult for me to do, so I do not see it accessible for many researchers. So we'll be talking about Kumu versus Python, which one worked better, what did we learn, what was the limitation of it, so we'll get into those things. First, I'll be talking about Kumu maps matrices. So Kumu applied these factors: betweenness, closeness, degree, eigenvector, in degree or out degree, and reach. So for instance, I'll show you the maps after this slide, but for instance, marginalization had the high betweenness, so it acts as a bridge. Systemic oppression has high closeness, which means it quickly connects to others, and invalidation has high eigenvector, meaning connected to other influential nodes. So let's see how that looks. So this is my first illustration. This map was generated by Kumu. Here we have binge eating disorder, and these are all the themes and sub-themes over here. Like everything is related to each other, but if you see those 100 percentages that are really close to binge eating disorder, so they're very close because they're endorsed by 100% of the 14 out of 14 subjects from the research. And then each of them are here. If you can see in the periphery, there are other sub-themes related to it. But if you can see, there's 93%, 93%, 79% are further from binge eating disorder, and 64% are like further than that. So if as someone who does not know what much about like data visualization, or has not understood like binge eating disorder or environmental factors, and they don't know how environmental factors work together, interplay to cause binge eating disorder. Like when you look at this chart, like you will know instantly, like it's about binge eating disorder, and these four themes are the most important or most closely related, whereas the one further along are less interrelated with that. Like, so it makes the data visualization aspect of it very easier for anybody to understand. Like if I show it to my mother, like she will be able to grasp the concept of it, which is exactly what Dr. Bray and the team and I want, because there's so many environmental factors. And when I looked at the environmental factors, when I was talking to Dr. Bray in the beginning of the project, I was like, how can we visualize it better? Because there's so many things going on and I can't comprehend everything. Is there any way we can visualize it so everybody, despite their knowledge of binge eating disorder or this environmental factor, can understand? So that was our goal. So as illustration one, you can see how it's been perfectly laid out for anybody to understand. Here's illustration two. It has other factors, other related factors, such as mental health, physical health, social health, public health, and welfare, such as like this related factors, and they are surrounded by binge eating disorder and the 12 themes found by Dr. Bray's research. So this is also very effective in talking about how in public health classes I used to learn about how there's like your like individual factors and how there's overall like overarching factors that affect all the individuals or community. So this way we can look at those factors and add those factors. And one good thing about Kumu Map is how, so I'm showing you just the pictures or the PDF version of the Kumu Map. When you go to the Kumu Map and when you click on mental health, for instance, it'll show just mental health and what other things are related to, or it'll make the maps much simpler. So if we do like large scale projects or research, you might have a question that like, oh, like this looks too chaotic. Like, how can we visualize it better? But Kumu is interactive map. So that makes the job easier of like, for instance, like if you want something tiny, like food insecurity with a 64%, like you can click on food insecurities and it'll show you only the things that are related to food insecurity. So it also helps with that aspect, which is also something that we worked on, and Kumu is really good with that too. So I really appreciate how Kumu is very versatile. Like you can use it for if you want to make a map of your own social networks, you can do that. For instance, like a hierarchy of your organization, you can lay out CDO and staffs and all like hierarchy in your office. That's one aspect of it. You can do so much with Kumu. It's very versatile. I would definitely recommend you all use it. Moving forward, we have Python maps matrices, which talk about coding aspect of it. So Python, for this project, we use two packages, NetworkX and Matplotlib library. And then these definitely replicated Kumo findings in terms of interrelatedness or closeness, as well as there was a little more we could do with Python, like layout and edge direction and node sizing and those things. The central are invalidation, oppression, and marginalized population, as you'll see it in the next slide. And the peripheral are food industry and nutrition scarcity. So here, what is happening in this slide is, if you look at the central elements like research and clinical gaps or trauma and adversity, these are the themes that have most relationship with other themes in the research, whereas interpersonal factors, the one in the periphery, are the themes with less interrelatedness. Like they are related with some themes, but not all. Whereas like invalidating environment and experiences are almost related to all the themes. And that is one thing that was unique about Python, but it does require coding skills. And I do recognize that not a lot of people, like if it was very difficult for me to do as well. So if you are someone who loves coding and who knows Python, you can try this. There's multiple sources on internet. There's plenty resource, which I'll be happy to share with you if you want to learn. But if you're someone who wants something simpler and want dynamic visualization, I think Kumu is a better choice. For my last slides, I have so what and what's next. So what? This research makes complexity visible. As you saw how complex, like drawing out the qualitative research or mapping them is. It's very complicated, especially when you have too many themes and sub-themes going on in the research. So it makes complexity visible. Like you can look at it and you can understand, like skim through it and understand much of it. And it bridges qualitative and quantitative research, which is something we worked on because a lot of coding aspect, or we had to make a heat map to do the coding. So that was like the quant of the research that we did. So it bridges those two, qualitative and quant. So it's mixed method study. It can inform clinical care as well as public health and policy, because a lot of these environmental factors are policy based, or like they're like community based, like these are environmental factors. So they interplay with each other, they're connected to each other. So it can inform the public who don't know much about the data or the subject to look at it and understand it. So that is basically the implications of it. Talking about what next, there's a lot of project that we'll be doing in days to come. I'm super excited for it. I have plenty of time in my plate to start new projects and continue with this project. So our plan is maybe in near future, if we have patient data, like a lot of like large scale study can be done. That was the expertise perception. We can also apply this to patients' perceptions as opposed to just expert views. We can do treatment access barriers. We can do systematic reviews of binge eating disorder and environmental factors and so much more, and apply social network mapping or thematic mapping to those studies that we do in future. So that's one of the projects that I'm really keen on doing. So I'm excited to do those. So yeah, those are some of the things that I want to be doing in future. Hopefully in our next summit, you'll get to hear more on that. And that is all I have today. If you have any question, me and Dr. B both can answer it for you. Yeah, thank you.